I think we're good.
Okay. Okay, so welcome everyone. My name is Ann Whitcup. I'm the head athletic trainer here at University Recreation. I know some of you, but there are a lot of faces in here I don't know. So just so you guys know a little bit about what I do for the facility and for your programs. I provide concussion education and awareness, which is part of what we're going to be going over today, as well as other, not less important, but less headliner type things. As well as providing injury evaluation, which I did today for 3 people, Alexis included. How did I do? Good. So if you guys have any injuries, you can come to me. I'm kind of the orthopedic specialist on campus in that most general practitioners, as far as doctors and stuff go, they don't necessarily know a lot about joint-specific injuries. So that's why I come in handy on campus, because I'm here for the entire student population. So anybody that has a rec center membership can come and see me free of charge to find out what's kind of going on with their injuries and what they can do about those. And I do offer rehab services for, I would say it's a nominal fee. It's $150 for the quarter. You figure out how many co-pays you're going to pay for physical therapy, and if you just pay $150 out of pocket here, you can come as many visits as I see that you need fit. Usually it's about 3 to 4 times a week, and take care of you over the quarter. Right now I have 2 ACL patients and another girl that has been working with a patellar dislocation issue. So, but I do a wide range of things that just happens to be all needs this quarter. So, if you guys have any more questions about some of the other stuff I do, feel free to ask me at the end, okay? If you guys have any questions about anything, we're going to go over slide by slide. Make sure you just go ahead and blurt it out, or if you don't want to blurt it out, raise your hand, okay? Because I don't want you to wait until the end and then forget your question, okay? So let's go ahead and get started. So what is a concussion? Concussions have been known by a lot of different things in the past. How many people have heard about getting a bell rung? I just got my bell rung, I'll be fine, okay? That's a pretty standard old school way to look at it. A concussion, we call them now traumatic brain injuries. We'll shorten that to TBI throughout the rest of the session here. A traumatic brain injury can range from mild to severe and can disrupt the brain, the way the brain normally works. Now the issue with calling it a traumatic brain injury, we used to call them mild head injuries, and then we found that people didn't take them seriously enough if we called them mild head injuries. They only saw the word mild and they just forgot about the rest. Okay, so now we're calling them traumatic brain injuries. According to the CDC, as many as 3.8 million sports and recreation-related concussions occur in the U.S. every year. The average lifespan of an NFL player is 57 years old, more often than not due to brain trauma. And that is not, it's not always CTE. I feel like that was a really scary headliner. That does happen sometimes. That's usually repetitive microtrauma to the brain over time, whether that is officially diagnosed as a concussion each time or not. And not everyone that gets multiple concussions will develop CTE. It's just like anything else. Sometimes people have a predisposition for those sort of things. So while I am trying to scare you a little bit about concussions, I don't want to scare you too much so that you're afraid to do anything. Okay? I just want you to be properly informed.
Question, this might be a better question for afterwards, but what are the long-term effects of concussions? And do you have services for people who have had multiple ones?
So to remind me about the second part of your question here in just a second. We can talk about, so let's talk about the long-term effects of concussion, okay? How many people in here, first of all, had a concussion? Okay, does anyone mind kind of describing how it felt? Go for it.
Felt like I was gonna throw up. Couldn't see straight. Like it looked like everything was blurry, and there was like a very large amount of ringing in my ears.
Okay, and about how long did that last for you, if you don't mind me asking?
Probably about like anywhere between 30 seconds to 1 minute. I don't know.
Okay, and do you know how long your concussion lasted? Okay, how old were you when you had it?
I was 17.
Okay, and that is part of why I asked, because the younger you are when you get your first concussion, the more likely you are to have repeated concussions after that, and the more likely the damage resulting from that concussion will be permanent. Okay, so the more concussions children, adolescents, adults, even you, all of you, do not have permanently developed brains yet. Your brains are still developing until you're about 26. So I'm maxed out right now because I'm over 30, okay? You guys still have brain cells that are growing and developing, okay? So you still need to take care of your heads, okay? Long-term effects of concussions can be pretty severe sometimes. Some of the symptoms that you were describing, some of that can be permanent. You can have permanent bouts of nausea every day. You can have permanent memory loss, that memory you're just never going to get back. There's a chunk you never get back. Sometimes people's short-term memory never comes back, so they can't ever remember where they put their keys. They can remember what their, what their grandparents looked like 30 years ago, but they can't remember where they set their keys 2 days ago. Okay, so they have to leave little sticky notes all over their house telling them what they did with things so that they can attempt to lead a fairly normal life as far as that goes. People can develop permanent balance issues. It affects our vestibular system in our ears. Okay, so sometimes people say they feel dizzy, they feel sick. Usually those kind of go together. But all of those can be pretty long lasting, and it all depends on how early on you had your first concussion and how many you've had since then. And usually if I know an athlete that has had 3 or more concussions, I will make them go get evaluated by a neuropsychologist before I let them back in play. So just, is anyone brave enough to tell me if they've had 3 or more concussions? Great. So if you don't mind me asking, when was your last one?
2 years ago.
2 years ago. So, okay, so you're a little ways out. How many have you had? Don't mind sharing. 3. Okay, so you.
My most recent one was earlier this year. We fell wrong. Aside from that, this is terrible, but I'm pretty sure I'm close to 4. So.
If you're pretty sure, you probably are. That is another thing that I provide for all of the club sports, and I mean for all athletes in general that use the rec center or any of its adjacent programs. I provide concussion evaluations. Most people don't know that it's a pretty extensive process to be evaluated for a concussion, and there should be a graduated return to play in which there are several days where you gradually increase your exercise and mental capacity over a period of, say, usually 5 to 6 days before you can actually go back to doing your normal standard activities that you were doing before. So the first day might be, usually it's a first day of complete rest, and I feel awesome this entire day. I feel completely back to normal for an entire day of rest. And then it's usually something like, I'm gonna go bike on the, bike upstairs for 10 minutes, and I'm gonna do 10 push-ups, and that's it. And that's all you get to do for that day. And then it'll gradually increase from then on to more and more difficult activities and for longer duration and for a higher intensity. How many of you that were diagnosed with a concussion have had a graduated return to play protocol? 1. Isn't that scary? Remember how many people held their hands up that they'd had concussions before? You should be going through that every single time. Okay, so that's another thing that I'm here for. And I'll be able to kind of let you know when you get evaluated for a concussion how severe I think it is, what you should do from there. Okay, and there are lots of recommendations that people don't usually think about. For example, you shouldn't take ibuprofen for your headache if you have a concussion. You should only take Tylenol because ibuprofen increases bleeding. So if you have any cranial bleeding, ibuprofen would make it worse. Okay, and that's something most people wouldn't think about. But anyway, I'm getting kind of off on a tangent here. I'll keep going. So what are some signs and symptoms of concussion? You shared a couple. Anybody else want to venture a guess? I'll start. Headache. Headache is the most common symptom that I see resulting from concussion. What else? Loss of what?
Loss of balance.
Yep. Balance problems. Yep.
And it puts someone in a really weird state of mood.
Yeah, it can change. It can cause mood swings. Depending on the individual, they can either be really, really excited when maybe they're more of an introvert naturally, or, for example, I was a manager for a high school football team when I was in high school, and yes, I've been with my husband this long, so I knew him in high school, and he actually got a concussion his junior year of football, and I remember him standing, talking to the trainer at halftime. And he was crying to her, telling her that he couldn't remember any of the plays, and he was panicking because he didn't know why he was crying, but he just felt like the sweat was on his face, and then he started to panic. Okay, and not all trainers are created equal either, because that athletic trainer actually put him back in the game to play the second half. And looking back on that now, it frightens me a little bit to know that can happen to, say, my kids that are 4 and 2 right now. So, just be vigilant for yourself and be vigilant for each other. If you see something, just let us know, okay? Or let your team captain know. And they can let me know. But it's more important, and we'll talk about why here, it's more important to just let someone know. What other kinds of signs and symptoms?
Drowsiness.
Drowsiness, yep. Vomiting. Okay, I have a guy right now that's still recovering from a concussion. It's been almost 4 weeks, and he's still feeling nauseous every single day. I would say he's into the post-concussion syndrome phase, which we'll talk about here in a minute. Guys see another hand? How about sensitivity to light or noise? Ringing in the ears sometimes, okay? I know another athlete right now that's part of his face is still numb right here. It's been over a week, and he can't feel this part of his face. That would be fairly serious. He should probably go see a neurosurgeon. Yeah.
So it can affect other types of perception, like could you develop synesthesia from getting a concussion?
Synesthesia.
Synesthesia? Like seeing colors, you know, like
It can alter stuff like that as well, yeah. There can be other vision problems as well. A lot of people will come and tell me, well, I checked his pupils and they were dilated, so he's okay. What we're looking for when we look at your eyes is not that whether first of all, we look to see whether your pupils dilate and retract or not, okay? But we also look at do they do it equally on both sides, okay? Is one more than the other? That would be kind of freaky, right? If we saw one that did and one that didn't. And that would lead us to, this might be a head injury.
What about like seeing kind of like kind of dazzled a little, like kind of
Definitely,
dazzling
kind of
lights a
seeing
little bit?
stars a little bit.
Yeah, or like just kind of bright shapes.
Yep,
Kind of like
definitely,
close, like
definitely.
you close your eyes for a while and open them, you start seeing.
Yeah, and like you said it lasted about 30 seconds-ish.
30 seconds to a minute.
You're lucky that it only lasted that long. Sometimes it's very individualized, but it can last days, weeks, months.
Can we also assume that all concussions result in renal bleeding?
No, and that'll explain in a minute. So when I feel like someone always asks me, what is a concussion exactly? What exactly is going on in the brain? Or is that what you were going to ask? Perfect. So the best answer is right now, we don't know exactly what is going on when someone has a concussion, because we can't call it cranial bleeding because there's not technically any bleeding going on if it's just a concussion, okay? We can't describe it as a brain contusion because a contusion would imply that there was some bleeding and that the bruise is still there, okay? What we do know is that there are severe metabolic changes that happen in your brain, issues with neurotransmitters preventing signals from going through. Okay, we're not sure why that happens. We just know that it does happen, and those are the markers that people look for when they're diagnosing a concussion, okay, in the clinical sense. Now, obviously, I can't do that out in the field or in my office, but if someone was going to do a special kind of CT scan or an MRI, because not all MRIs will be able to show a concussion. In fact, most can't. So if you guys got a concussion and you were sent to the emergency room, let's say I wasn't there, someone sent you to the emergency room, and they did an MRI and they said, oh, you're fine. It's because I can't see anything on it anyway, okay? So just because they say there was nothing on the MRI doesn't mean that it's not there, okay? So we know that there are metabolic changes, there are changes with neurotransmitters functions, okay? And that's about the easiest way to describe to you kind of what's happening, but yeah, it's a little bit different than actual bleeding.
I mean, like as far as looking at their pupils, we can tell dilation. Are there any things you look at in the eye that might suggest?
Sometimes there will be other bleeding in the eye, like what's that called? I haven't had to remember that term since graduate school. It's been a while. But there is a kind of bleeding that if you see bleeding out into the iris of your eye, so the colored part of your eye, that would be a signal, pretty significant head injury. And probably something that someone wouldn't just like say wander into my office and be like, I've got this weird bleeding in my eye, I don't want to know what it means. It's probably like they got hit in the head with a baseball at 90 miles an hour sort of thing. So it would be something fairly traumatic that would jar that eye enough to cause that bleeding, if that makes sense. Okay, so when we're talking about bleeding within the brain, okay, this is important not for concussions, but for a little more serious injuries that we'll talk about here in a second. So we have our outer layer of the skull. I wish I had something to point with. So we have our outer layer of the skull, okay, right here, this bony porous part. Right underneath we have what is called the dura mater. Okay, it's kind of a tough protective layer that lines the skull, so everything else is underneath that, okay? Now right underneath that, we have our, excuse me, our subdural space, okay, which we can kind of see here. Okay, and then we have our arachnoid layer, rich in blood vessels carrying nutrients to our brain. Okay, under that we have our subarachnoid space, and then we have this thin little layer right above the gray matter, which we call the pia mater. And what do all these Latin terms mean? Okay, why are they important? Then if you check here, we've got skull, we've got dura mater, we've got subdural space, except that we really can't see a whole lot of space in there, right? Doesn't it look like pretty much we're just sitting right on this next layer here? If there's not a lot of space in there, if there's bleeding occurring in there, how quickly do you think you're going to be able to notice a difference in someone's neurological functions? Pretty quickly, okay? There's nowhere for that bleeding to go. It's going to rapidly press down on this brain, okay? So within the span of 15 to 20 minutes, it's not going to present like a normal concussion anymore, okay? It's going to, you're going to know that you're going to need to call 911 at that point, okay? And that's called an epidural hematoma. Okay, so we're talking about epi means right above the dura mater. I explained one and then the other. So epidural hematoma between the dura mater and the skull here, which obviously there's still not anywhere. Okay, so if we're talking about a subdural hematoma, hematoma just means massive amounts of bleeding. Okay, heme means blood. Okay, so if we're talking about underneath this dura mater, we've got all these nice blood vessels. There's lots of space for blood to pool in here. So the subdural hematoma, you might not see the effects of it for days, weeks, months. We're talking 6 to 8 months sometimes before it finally gets picked up by a physician.
What are the physical signs?
At an epidural, it's going to present like a normal concussion for an epidural hematoma for about the first 10 to 15 minutes. Okay, so they'll have trouble remembering maybe what happened in the game, or maybe they just got a really splitting headache, or maybe they're a little bit nauseous with a headache, something like that. And within the span of the next 15 minutes, that's why I check someone every 10 to 15 minutes, okay, to make sure this isn't happening. Within the first 10 to 15 minutes, they'll get to the point where they're neurologically, like they're not responding to your voice, they're not talking to you. So it'd be, you can almost think of it as like sort of a pre-coma sort of thing, where they're just not functioning on a normal level, okay? And adolescents are fun. Okay, so I mentioned earlier I had an athlete with post-concussion syndrome. Basically what that means is that the signs and symptoms of said concussion have lasted longer than we would normally expect for a person of his age and his history, okay? So right now he's about 4 weeks out, still having symptoms. About a week ago he said it felt like it was still the first day afterwards, and he just laid in bed all day and felt nauseous and threw up all day long, okay? It's not fun. So I'm going to check in with him later today and see how he's doing. There's no like cure, no treatment for this except for rest. Don't exercise. Take care of yourself. Eat well. Sleep a lot. The only time your body heals itself is when you're sleeping. So how many of you get at least minimum 6 hours of sleep a night? Okay, you should get more than that, by the way. You should probably get about 8, but I know you're college students, so it's difficult. But if you're injured, you need to try and maximize the amount of sleep. Regardless of what kind of injury it is, you need to maximize the amount of sleep you're getting so you can heal up. Okay, so that's the only time that happens. Second impact syndrome. Does anyone know what this is? What does it sound like? It sounds terrible. A second concussion after the first is resolved. Exactly. Okay, so if I let this soccer player that's still having symptoms 4 weeks out go back in and play another soccer game and he gets hit in the head again, massive cranial bleeding will result, and he will die. He has a 50% chance of death, okay? Half the people that get second impact syndrome die. And that doesn't mean the other half walk away from it looking like you and me, okay? They walk away with it with severe neurological damage in their brain, to the point of where they never walk again, they have speech impairments, they might have, it just depends on which part got smashed by all that bleeding. And then we talked about subdural and epidural hematomas. Skull fractures usually won't occur without at least one of these in addition to a concussion. And usually skull fractures are just an indentation. They don't like shatter anything. Okay, how many of you in here have iPhones? Feel free to get them out at this point. I know, I'm telling you to take your phones out. Go ahead and get your phones out. Okay. For you guys, we want you to use this basically when I'm not there to check whether you guys have concussions or not, okay? If you can download, if you can't do it now, try it later, okay? Download the Concussion Quick Check app for iPhone, the American Academy of Neurology. I'm gonna actually go look and see what the icon looks like so I can let you guys know here. Is it green now? It used to be blue, I didn't want to tell you wrong. Oh, here it is right here.
Hey, if you got an Android, that's it on that too.
Does it? Awesome.
Yep.
I always get that question and I have no idea because I've had an iPhone forever.
Yep. American Academy of Neurology, right?
Yep. Yep. Is yours green with a check mark as well?
Yep.
Perfect. Okay, so this is going to be really easy to look. It says tap icons or swipe to start. Oh my gosh, this is so easy. Okay, so if you click through them, hit the arrow on the right at the top, common signs of concussion. That's really easy. If I have a teammate that has any of these, maybe I should wonder if they have a head injury. I should probably pull them out. Okay? Okay, more signs and symptoms of concussion. Okay, next one. What should I do if I pull this person out? When is it safe for them to go back in? Okay? It will tell you exactly what to do. Okay? Immediately address safety concerns. If the person's unconscious, check their ABCs. Okay? It's giving you literally step-by-step what you need to do. Okay? So, when is it okay for an athlete to go back in after they've had a concussion? After being cleared by me or, right, exactly. Yeah, so they need to be cleared by a medical professional experienced in working with concussions, okay? I've gotten a lot of students that say they just went to their general practitioner and they said, are you feeling fine? And they're like, yeah, I'm not having my headaches anymore. Okay, great, you can go back in and play soccer. And then they play for a couple of days and they're like, my headache's coming back. I don't know why. And so that's the purpose of the graduated return to play, is that we would find that out and have to back them a step and let them have a little more rest first. Okay? So we click. If you suspect the person has a neck injury or if the person's unconscious, it'll tell you what to do for spinal stabilization there for the neck. When is it okay for the athlete to return to play? Okay, it'll even give you a map. You can use the map to find neurologists in the area, depending on where you are. Okay, so pretty handy thing for you guys to use. And in the absence of someone like me, it's probably the easiest thing you can do, and it'll protect you because you're using something that is provided by neurologists. Okay, so it's just easier to go to that and use it than to try and guess yourself and then get in legal trouble later. Okay, we don't want that. Well, that's all my directions for. Okay, what else should we expect? Often with head injuries, especially if there's any kind of loss of consciousness, which, by the way, is a fairly uncommon thing with concussions, we need to suspect spinal injuries. So the only thing you guys need to worry about as far as spinal injuries go is whether someone is having unilateral or bilateral neurological symptoms. Okay, so if someone says they have tingling in this arm, that's not at the spinal level because it's only on one side. Okay, so that would be, has anyone ever had a stinger or heard of a stinger before? Okay, so that means a stretch occurred here at the brachial plexus and not at the spinal cord. Okay, if someone says they have tingling and numbness in both hands or it's up both arms, then you have to worry about some sort of spinal injury. So make sure, for heaven's sake, don't move them. Okay, if you are appropriately trained for state CPR and you are comfortable stabilizing their head and neck, you can by all means do that, but I am not going to push you from my standpoint to do that because I don't want to put you in that situation. Okay, so I'm going to leave that up to you guys whether you prepare for that or not. And we would, of course, call 911, right, in that situation. So we'll talk a little bit about heat illness. Heat illness is more common in hot and humid conditions. I feel like we hear it every fall when a whole bunch of football players go back to preseason and they're doing 2-a-days and all of a sudden there's this big issue with heat illness and these kids are getting sick, they're growing up and they're dying of heat illness and heart conditions. But it can occur in a colder environment as well. So what are heat cramps? Somebody's probably at least experienced heat cramps here once. Yeah, it's just like any other kind of muscle cramps. It's just due to the heat and dehydration, right? Feels awesome. Okay? Heat exhaustion. What's heat exhaustion?
Dehydration, not required heat stroke.
Okay.
Definitely not good.
Right, definitely not good. That's the warning sign, right? Take care of this person now or something
Right.
bad's going to happen.
Yeah, take care of them now or they will get a heat stroke and that's when things get really bad.
Right. What were you going to say?
Oh, yeah, I was just gonna say it's a sign of severe dehydration.
Yeah, okay, so what kinds of things are we looking for if someone has heat exhaustion? Cold, clammy skin, okay?
Nausea.
Possibly. Profuse sweating, okay? Pouring sweat, trying to cool themselves down. Did I hear something else? Often pale, okay? When we get to heat stroke,
Or sticky. You're not
their
sweating
skin's
anymore.
starting to dry out because they're not sweating anymore, right? So they're gonna get that kind of like tacky feeling on their skin. They're gonna start to get red in the face, red in other parts of their body, okay? This is to the point where, yeah, this is a 911 call. In graduate school, they taught us that before we were supposed to call 911, we were supposed to immerse the person immediately in as much cold water as we could, like up to their neck. It was so important to get them cooled down quickly that we were supposed to do it before we called 911. Okay, so if you happen to have a cup of very cold water, by all means do that before you call 911. Don't run around looking for said tub of water before calling 911, of course. So, yeah.
Do they have to be totally immersed, or if it's something where you can
As
shove
much
in
as
a
you can
cold
possibly
shower?
get, yeah. As much, whatever you can do. So for heat exhaustion, how are we gonna treat heat exhaustion? Back up a little bit here. We still need to cool them down, right? So what
Give
do
them
we
a
do?
shade, give them a lot of water.
Shade, okay, peel off extra layers of clothing, give them water. You can apply cold packs or cold towels, wet towels, okay? Where would we put those if we're gonna try and cool somebody off? Okay. Any place you'd stick your hands to warm them up. I'm not gonna do this one, okay? But I know that guys do it, I see them do it on the field all the time, okay? Anywhere you'd stick your hands to warm them up, okay? Those are all the places where you have a superficial blood supply, okay? So that's gonna help cool you down pretty quickly. And then heat stroke, like I said, immerse the person as quickly as you can in as much of the water as you possibly can, okay? Call 911, and they'll take over when they get there. Usually people with heat stroke end up spending 3-4 weeks in the hospital, and they usually have some sort of permanent organ damage. So just depends on what was affected first. So our emergency action plan. How many people know what an emergency action plan is? Okay, can you tell the rest of the group? Anyone?
In case there's an emergency, you have to plan, so when ready, you need to go first,
And who does what?
call 911, and get medical personnel.
Okay, have anything to add?
Yeah, just what to do in a certain point.
Okay.
Who goes where, who's in charge.
Excellent, that's pretty much exactly what it is. So in our facility, I'm the one in charge of putting all this together. It's a little bit challenging because you guys compete at so many different venues and so many different places, but we do have it in place. It is on my webpage if you want to look at it in its entire glory of 30-some pages. But it's most important for you to know the emergency action plan of the place that you are playing at that point in time, okay? If someone needs to call 911, who is that going to be? Who is going to go out to the street to direct the ambulance to the person that's injured? Because the ambulance is going to see a whole bunch of people. They're not going to know who the injured person is, okay? Who is going to be responsible for providing care while that person calls 911? You see the kinds of things that we want you guys to be thinking about, especially when you're on the road or at a venue that's not on campus, okay? The nice thing about being on campus is we do have a lot of people in place to be of help to you. But if you guys have any specific questions about that, by all means, ask me. Like I said, it's a pretty detailed plan, and it even goes into the kinds of first aid kits you guys have. All that stuff is listed in there. So, and what would be in those first aid kits as well. So, and that is part of our emergency action plan, to make sure that you guys have first aid kits at all events. If you guys need those refilled, just drop them off, and we'll refill them, and then you can take them back. Usually same day or next day at most. So. Oh, and there's our heat illness. So there is an app for heat illness as well, and it will take information from the nearest weather station, give you a heat index, and that heat index will then tell you, okay, well, it's this hot today, so we need to make sure we give our players breaks every 30 minutes for water. Or maybe it's, we only practice inside today because it's too hot to practice outside, or something like that, okay? But it's really, really handy, honestly. So, Coach Smart app for iPhone. Lightning safety, okay. Identify locations unsafe from lightning. If you practice and play indoors, you don't have to worry about this, but if you're out on the field, we don't have a lot of really bad lightning storms here, but we do have lightning, so it is an issue sometimes. The only places that are going to be safe in a lightning storm are going to be either a vehicle with all the windows rolled up and rubber tires, okay, or a building with 4 walls and a roof, okay? So like those picnic shelters at the park, they're not going to do you any good, okay? You got to make sure you get inside a building, okay? Postponement and resumption of activities. So if we see lightning, we automatically call the game, okay? And we call the game, we put it on hold until at least 30 minutes past the last lightning strike or the last sound of thunder, okay? And if, let's say we're about 20 minutes into that 30 minutes, we just started timing, okay? And then all of a sudden we hear thunder again, we have to start all over again with the 30 minutes, okay? Is that easy enough to remember so you guys go down the road? And that's a recommendation from the National Athletic Trainers Association. So reporting accidents and injuries. I feel like there's probably a lot of stuff that happen to you guys every day that you just don't report that we probably should have record of. Okay? You guys know about our secondary sport club insurance policy. So after, let's say you get injured, you sprain your ankle, and it turns out it's bad enough you need an ankle surgery. Okay? After your primary care picks up whatever they're going to pick up, the secondary policy through the sport club office will pick up the rest of it for you if there's anything left over, okay? But in order to do that, we have to have a record of an accident report, which is why I'm always harping on you guys to fill out accident reports, okay? Because I have had more than one situation where someone has a knee surgery and there's $5,000 left over after their primary care is done, and they didn't fill out an accident report, so they don't get it covered and they end up paying that out of pocket instead of having our secondary policy cover it for them. Okay, so, and it might even be for things you guys don't necessarily think about. Like, let's say you were on the we have a wrestling team. They actually had to do this last weekend. Let's say someone's on the wrestling mat. Is anyone familiar with wrestling in here? Have wrestled or okay? So, are the mats clean?
No.
Not usually. Okay, I really have to harp on getting them cleaner, and it's just kind of a thing that goes with wrestling in general. I feel like, but so the mats aren't the cleanest. Okay, same thing with like a turf field outside, okay? They tend to hold bacteria and fungus, okay, fungi pretty well. So if anyone has an open cut and they're just out there wrestling for 3 minutes, okay, they might pick something up on that mat and they might not think anything of it. Oh, they just come in for a cut, I put a Band-Aid on it, they're fine. Should probably fill out an accident report for that in case it turns into something like MRSA. Has anyone ever seen a good like video or picture of MRSA? They actually have to use like an ice cream scooper tool to scoop out the dead and infected flesh out of your body, okay? So you usually end up with like, say, a nice hole in your quad that's, about that deep, okay? Because of a MRSA infection. So that's something I'd report if I were you. If you have a cut, you never know what it's gonna turn into, and it'll probably be fine, but at least there's a record of it in case you guys need help later, okay? So by all means, just fill out those accident reports and send them in to me. Okay, so these are some things that I've run into over the last few years. Just make sure your writing's legible. There will be places to put a student ID. Just fill it out as completely as possible. Most of the time, either the date or the time of the injury will be excluded, and it's really hard for me to track down, say, who our staff was that was working at the time if I don't know what time it just says Saturday, November 11th, and it doesn't say what time of day, or that could be anywhere between 10 a.m. and 11 p.m. So I'm not really sure who was working out. See what I mean? So it's best to be as detailed as possible, okay? Describe in detail what you did for the victim. Even you just put ice on it, say I put ice on it and sent them to the emergency room, okay? Make sure to circle whether medical treatment was provided or required, and who did or will be performing those services. So if I'm there, most of the time I will be helping you fill out the accident report, okay? So I'll make sure all this gets taken care of. But if you're helping a teammate, for example, you might have to fill some of this out for them, and you'll just have to be making sure that they get all these important things done. If you're filling it out for someone else, it helps me to have your name on there, legibly, of course, so that I can contact you and ask you. For example, if the wrestler with the MRSA, okay? If we have a wrestler with MRSA and he fills out the accident report, but I can't really read what's happening, okay? Like, let's say his writing's pretty illegible and he was pretty worked up at the time or something, I don't know. then I'd be able to contact a staff member or you, okay, if you help them fill it out, and ask you what exactly had happened, so then you go, oh, okay, it's just MRSA, it's not, my leg fell off. You still got the leg, okay? Where do these get turned into? Alexis knows. They can go to the access desk. If it's between 8 and 5, Monday through Friday, they can also go to Allison at the admin desk, okay? Either of the front desks is fine. Those are where they go. You don't need to come all the way back to my office to drop those off, okay? Which also makes it easier for you guys. And you don't have to find Corey either, or Justin, okay? So make sure to review your emergency action plan. Like I said, it's up on the website. Just review the parts that are most applicable to you. Some of it might not apply at all. Okay. For example, if you always compete off-site and you're never in the recreation center itself, you won't need to worry about how to evacuate from a fire and rec center. Okay, so that part will apply. Part of this plan is keeping up to date on CPR. Make sure that several of your club members are certified in both CPR and first aid to remain in good standing. Justin, are you guys requiring 2 from each right now?
Yep.
Okay. So it's possible to have as many as you want, right? But how many do they need to have to travel?
Any of this traffic
Okay,
on
so
site at all times.
right. Any questions on that? Okay. The last thing we're going to talk about is facility conditions. Just make sure you're aware of your surroundings, okay? And make sure you know what the field looks like. Think about what's next to the field. For example, the old rugby pitch out there is right next to the baseball field. Does everyone know the concrete slab that's like sticking out within like 3 feet of the field line? Okay, it's kind of scary. I've had more than one person come really close to hitting their head on that before. So that's not an ideal situation. Okay, that might be something obviously we can't remove the concrete slab. We might want to pad that in case someone runs into it. Okay, so things like that. If something is unsafe here, by all means report it to me or Corey or Justin or whoever else you communicate with as far as your club goes on a daily basis. Okay. Off-campus facility. Justin, what do you want them to do in that situation?
Sure.
Off-campus, if they need to report something unsafe off-campus, like if they're competing at
Contact
Wazoo.
Corey. Yeah, contact Corey, set up the plan. So we are rolling out emergency action plans for each facility, which come winter we should all have that finalized. So for every facility, there should be notable any issues or if there's something that's of concern, we can document that. As of right now, we know the majority of all the issues that are going on right now with facilities that are on campus for the most part. So we'll be communicating with all of you guys.
And equipment inspections. So what equipment should be inspected? Depends on what event or what club sport you're in, right? Okay, so who inspects it and how often? How many of you inspect your equipment on a regular basis for your entire team, not just your own? That's good. Yours is fairly dangerous, so it's probably a good idea. And when was it last inspected?
Last week.
Yeah, good. That's awesome. Ideally, it should be inspected before the start of the season, okay? And it should be inspected at fairly regular intervals for the rest of the season, okay? Now, I'm not talking, maybe every week even isn't necessary unless there's some major issue with something. But probably 3-4 times a year, anyway, they should be inspected, okay? Where it gets really, really important is when we're talking about things like face masks, helmets. When was the last time that lacrosse had their helmets inspected?
Well, we just got all brand new ones, but before that it was like 5 years, maybe 6.
Which is bad. That's really bad. Probably leaving you open for some head injuries there. So that's good that you guys all have good helmets. Any questions about equipment inspections? Any questions at all? Yeah.
Should we be requiring club members to get a tetanus vaccine?
Man, I've never been asked that before. What's the likelihood that someone's gonna get?
It's very rare. It's every once in a while the blades break.
Okay.
But that's about, and then usually we catch it before anybody starts testing again with it.
Right.
Because it's fairly obvious that the whole thing broke apart.
Right.
It's
so
not
it's
common,
fairly-
but it does on occasion happen.
No one's gonna cut, yeah.
Okay. I would say from my standpoint, no, it wouldn't be necessary to do that, but if that's something the club wants to do, that's certainly an option that you can pursue. And, I mean, with my support, if that's what you want. So, yeah.
This is a little bit of a strange one, but concerning equipment, when it comes to inspecting equipment, is it only equipment that is used for contact, or would stuff that we use for individual practice only need to be inspected?
I would inspect all of it.
Okay.
Yeah. What are you thinking of specifically? Or are you thinking of anything specific?
Yes, I'm thinking of something specific actually. In the karate club, we use both foam and wood nunchucking.
Oh, okay.
Or spinning, yeah, those things. Now, I inspect my own, but the club advisor controls all of the foam ones. As far as inspecting those, it's not a big deal. They foam up and slam the head with them multiple times. They don't do
Right.
anything. As far as the wood one goes, depending what kind, they're both cord and chain. I personally use chain because they don't break. The wood ones, though, they start to fray and
Yeah.
got a big old piece of wood on the end of the string.
Right, exactly. No, yeah, those probably need to be inspected fairly. I mean, how many times a week are you guys meeting?
Right now, we meet 3 times a week.
Okay. I would say at least once every other week,
we
depending on
don't-
how much you're giving out of them.
Yeah, we don't use them 3 times a week. Most of the time, it's once a month, only leading
Oh,
up
okay.
to a specific event.
Once a month would probably be fine then.
Okay.